Okay, so it's June 2018, Fort Myers, Florida. I'm Dr. Scott Geller. We have a great patient from Englewood, Florida, a construction builder by trade, the boss, not the actual builder. But tell us, when did you start having this problem in the right eye?
Oh, about 4 years ago.
4 years ago. And you had another issue that was unrelated,
Right.
optic neuropathy, which was resolved basically by itself.
Right.
When you had this come on 4 years ago, it was at the same level as when I saw you? It just happened all of a sudden, basically?
No, it progressively got worse. It was
Yeah.
started out as just little hair things and little spots floating around in there, and then as time progressively went on, it seemed like it basically all just clustered together.
Yeah, and you went to several ophthalmologists for that issue,
I did.
and they looked at the chart, of course, and the chart says you're 20/20, and you're complaining, and they are not tuned in. Did they recognize it as the floater business?
Yeah, they said it was floaters, and basically you just have to learn how to deal with it.
But they didn't quite understand the severity of it. We all have some floaters. I have some amoebas I can see in the
No,
sky.
that's basically what I was saying. I was like, okay, well, everybody says they have floaters. Even friends of mine say they have floaters, and I'm like, and I'm thinking to myself, you can't see what I'm seeing, because obviously, if you were seeing what I was seeing, it's very annoying.
Yeah, and well, I think the problem in ophthalmology is that they don't take the worst vision the patient has. You're always trying to get the best vision on the eye chart. You move the thing out of the way. You're 20/20. You're complaining, and they think you're just a crank, a whiner, whatever.
20/20 was there, but it's seeing through everything you had to see through. To
Yeah,
get
yeah.
the 20/20.
I'd say when I saw you, you had a very large fibrillar mass in the mid-vitreous, and what I mean by that is it looks like a big ball of cotton candy or a dust bunny you'd find behind your dryer at home. And it was always more or less dead center, correct?
Right.
And you had to shake your head to get it out of the way,
Right.
or see
Right.
through the rearview
Right.
mirror in
Or
the
go
car.
home and close the blinds and just
Yeah.
stay in the
It was more
darkness.
disabling than the doctors realized, obviously. And you finally found me somehow.
Yep.
And
Research. Just not
fortunately,
giving up.
yeah,
And I
exactly.
guess
I've been doing this a long
God
time.
might have had something to do with it, because I think you're an angel myself.
I've been doing this a long time. The retina guys up there in Sarasota know I do this, but I've only seen patients who've come on their own. So anyway, we did 2 laser sessions, and this was a third laser session today. Was it third today?
Third today, yeah.
And basically, in a case like yours, I've gotten that mass out of your visual axis. So what are you experiencing now?
Clear vision.
Oh, that's what I like to hear.
Clear vision and total peace. I mean, like I said, I couldn't imagine before I found you at 55. I didn't know how I was going to continue on seeing what I could see. It was just
You weren't going to kill yourself or anything.
No, I'm not going to say that, but it was very annoying. I would say by between 11:30, 12 every day, I'm trying to head back to my house. I'm closing the blinds. At night it wasn't as bad, because obviously you're not getting all that sunlight in your eyes. So I prayed for darkness. You know what I mean? And now,
of course.
Now I can actually enjoy myself, go outside. I mean, it was like boating was almost impossible, because there was always things moving around in your eyes, and
and ophthalmology, sometimes medicine moves very slowly. They just don't take the time to be a detective and ask the patient, well, what do you mean your vision's blurred? I'm looking at this medical record, it says 20/20.
Right.
They just don't understand it all the time,
Well, like
which is unfortunate, but I try to put it out there.
I said a lot of times, I said to a lot of people, I said, I wish I could just take my eyes out of my head and put them in your head for just 30 seconds and let you see what I was seeing, and then you would understand, because I think that's the only way that they would ever really understand what you were seeing. Because you always talk to people and they're like, well, I got floaters too, it's not that bad. Okay, well, you got floaters, but how many of them do you have? And are they all
Yeah, they're not
together?
like yours.
They're not having a big party in front of your eyeball.
Right. Well,
You know what I mean?
you
It was
definitely
terrible.
had something that was, I'd say, in the upper, 30, the upper third of the kind of stuff I see. And it can be very disabling. Fortunately, you have 2 eyes. If you had just one good eye, you'd really be having a problem. But you're a great patient. I always enjoy getting a good result. That's
I can't
why
wait
I
to do
keep
the other
doing
one.
it. Okay. Thank you so much.
Yeah, thank you.